Hello and welcome back to another episode. I'm your host, Dr. Judy, and in this video, I will be sharing with you what you need to do before you go to the doctor's office. These tips that I'll be sharing with you are from my experience as an internal medicine doctor working 11 years, as well as my recent experience as a patient. Now, so let me tell you what really stimulated me to do this video like today. So over the past few years or so, I've had long COVID, persistent symptoms ever since I got COVID the first time in August 2021. Now, I've seen a lot of doctors and have really experienced the other side of healthcare. And my heart truly goes out to those of you that have to make frequent appointments with medical professionals. My heart goes out to you, particularly if you are not a healthcare professional. And I say that as someone who understands the language. I understand how doctors think. So I know what information I need to bring to them in order to make sure that I get the best care that I need and that I deserve. The fact of the matter is that most doctors are too busy and they see too many patients. Many doctors are stressed out and burnt out. There's no excuse for that. However, I have observed as a patient that most doctors are terrible listeners and lack empathy, meaning they are a bit impatient, I find. And I say this gently because I really don't want to offend anyone, but this has just been my experience. And so I can imagine what it's like for you. And I'm seeing my colleagues, sometimes the appointments that I make are with people that I know. And I just find that across the board that doctors are terrible listeners. They don't really listen to your symptoms. And I find that sometimes they're even quick to dismiss your symptoms if it's something that they don't understand or that they don't know the answer to. And rather than saying that they don't know, the profession really trains doctors to carry themselves with this aura of, I know everything. And I remember in residency and even in medical school, the students that appeared the most confident got better grades. It didn't matter whether what they said was actually correct, but I noticed that this is in medical school. I noticed that those students that were the most confident got better grades. And early on, I was not confident. And I remember my attending one time saying that you just got to fake it until you make it. And what she meant by that was pretend to be confident, to pretend to know what you're talking about, even when you don't. The culture really discourages physicians from saying those words, I don't know, or I'm not sure, right? Can you think of the last time, or have you ever heard a doctor say that to you? It is not acceptable to say such things, right? But what I've been finding is that it's actually harmful to the patient when the doctor does not admit that they don't know. So going back to the condition that I had, right? Long COVID. I know more about that condition than most any doctor that I'm going to see. I've done extensive research on it. It's my body. And so that's the first thing that you need to do. Whatever condition you have, you need to make it your business to know as much as you can about that condition. Not having a healthcare degree is no excuse. With the internet, there's so many great websites that you can use. There's AI that you can use. I recommend Mayo Clinic and Harvard websites to look up information about your healthcare condition. You need to understand what caused it, the treatments that are available, because you cannot trust your doctor to tell you all the treatments that are available. Again, the visits are too short, they're rushed, they might forget. So you need to know all the treatments that are available, just the basic ones, right? And you also need to know what medications that you're taking for that condition, right? It's not enough to be like, oh, I'm taking 6 medications and I don't know what I'm taking them for. How do you know that it's not the wrong medication? So you must know what medications you're taking and for what indication you're taking them for. So the first point is do your research. Before you go to the doctor with any problem, you should look things up. And I know sometimes my colleagues don't like patients to look things up. And I think that really is just their ego, to be quite honest, because it is better for us as physicians when the patient is more informed, because you're able to give better information, a better history, and the conversation that we have is elevated. And so I always encourage my patients to look things up. Don't come to the doctor's office expecting the doctor to know everything, to tell you everything. You must do your own research. You cannot trust your doctor and depend on your doctor to be able to tell you everything about your body. You live in your body 24/7. So you need to be the expert of your own body and your own health. I like to say you need to become the CEO of your health. So that means that you think of your relationship with your healthcare team as you are the CEO and you're helping to manage the different providers, because they don't talk to each other. If you're seeing different specialists, you already know this. They don't talk to each other, and sometimes their recommendations contradict one another. As a generalist doctor, I see this all the time. Cardiology says one thing, nephrology says another thing, and they don't talk to each other. And the primary doctor, the general doctor, myself, is left to try and make sense of it for the patient and come up with a plan that makes sense, that's not just focused on the heart and not just focused on the kidneys. So do your research. Okay. Yesterday I had an experience. I went to see a pulmonary doctor because I've been having some strange shortness of breath that only happens on the airplane. I've done my research on the situation, right? I've spoken to other people that have long COVID. So I know for a fact that it's related to problems with oxygenation, the mitochondria, and in the altitude, there's less oxygen in the air. And due to the atmospheric pressure, it's less oxygen in the air. So a potential solution likely is going to be to get portable oxygen. So I make an appointment with pulmonary because that's who prescribes oxygen. I made this appointment 2 weeks ago. And this is someone who I know personally. We used to work together in the hospital for at least 2 years. So she knows me. She did not look up anything about my condition. It was evident. And then the thing that really, really bothered me, and not because I care what anybody thinks about me, because I really don't, but because I felt what many of you probably feel when you go to the doctor. So the appointment was late. I was there on time, like they tell you to, but I was waiting, got my vitals checked. An hour had passed before I actually saw the doctor, but I wasn't tripping about that because I didn't have anything else to do that day. So it was fine. But at the end of the visit, at the end of the conversation, she ordered some testing and she fixed her lips to say, well, maybe it could be a panic disorder or a panic condition. And I said, I did my face like this, right? Because my facial expressions don't hide how I feel. And I was like, is there any evidence that I'm anxious or that this is a panic attack? She didn't say yes and give me any evidence. She was like, well, sometimes when people have shortness of breath, that's what it is. And so I said, well, I shared with you already that I've traveled the world extensively. I've traveled on planes for 15 hours with no problem. And I'm only now having a problem since my COVID infection. And I literally in that moment, I stopped her because I'm a very direct person. I'm not going to talk about you behind your back. I'm going to let you know that what you said is inappropriate. And so I calmly said to her, you know what? This is a problem in medicine. Medicine really needs to do better because there are so many patients who come to doctors for help. They have symptoms. They have vague symptoms. The doctor doesn't know the answer. They may not know the diagnosis. There are a lot of people who the diagnosis of what they have is a mystery and the treatment is a mystery. And doctors are too quick to dismiss people and put them in the category of, oh, it's psychosocial, it's psychological. And I'm sure that there's other people that do this too. So it's not just doctors, but I'm just saying this because doctors are called to a higher standard, I think, than other healthcare providers. And as a doctor myself, I'm confident enough to say this and criticize my own profession because I'm not afraid to call out things, even myself. When I'm wrong, I call out myself. So on this case, I'm saying plainly that sometimes doctors do a poor job at listening to patients. And I was so disappointed in her because she knows me. And I asked and I said, you've been working with me for 2 years. We've taken care of sick patients during codes, rapid responses. Have you ever had any evidence that I had any panic or anxiety? And she said, well, I don't really know you like that. And I said, you're making a statement based on no evidence. We're supposed to be practicing evidence-based medicine here. It would make more sense if there was something that would lead you to believe that the reason why I'm short of breath only in the airplane was due to anxiety. But I just already told you about the pathophysiology of long COVID. And I said, respectfully, ma'am, I really think that you should do some reading, go home this evening and look up about long COVID, look up about mitochondrial dysfunction, and look up about altitude sickness and jet lag in people that have long COVID. Yeah. And I was so disappointed, to be honest, because people are pretty frank with me because they know I'm open-minded and I don't get offended. So you can tell me whatever you think about whatever group I identify with. I'm not going to be offended because I know who I am, right? But I hear so many patients say, especially in the long COVID group and people with conditions that medicine doesn't understand, like chronic fatigue syndrome, chronic pain, fibromyalgia. We don't even learn about fibromyalgia in medical school. We don't even learn about these chronic pain syndromes, right? But there's so many patients that feel like they're gaslit by doctors. They feel like their symptoms have been ignored. They feel like doctors don't listen to them. And they're so frustrated. They have stopped going to doctors. They're like, I give up. And it's so heartbreaking to me to see because doctors are paid pretty good money. And you pay a copay for your insurance, right, to go to the doctor's office. You also pay a monthly premium for your insurance. So you deserve to see a provider who's going to listen to you, who's going to validate your symptoms, and who's not going to dismiss you immediately right off the bat just because they don't understand what is going on with you, right? This was my first visit with this provider. It was completely out of order for her to even think. And why I was so bothered by the fact that she was thinking that was because I know what happens once a provider in their mind, once they think that it's psychological, they stopped being open-minded and they stop investigating. They stop doing the research, right? Because their brain tells them, no matter what research I do, it's going to be a waste of time because this patient is just anxious. And it really is an ego problem. It really is an ego thing because doctors don't like to admit when they're wrong. Doctors don't like to, like I told you, the training trains us not to admit that we don't know something. So it's really bothersome for physicians when we don't know the answer, when we cannot find the diagnosis, when we cannot successfully treat a patient. It really is bothersome to us. And so I think sometimes what doctors do to ease that burden of their damaged ego, they blame the patient. They dismiss the patient. And it's not right. And it shouldn't happen. And for those of you that have been treated like that by physicians, I'm sorry. And just know that although I'm not practicing clinically anymore, as God has led me into a different path currently, when I practiced, I was never like that. I became known as the doctor that always listened to patients, that always validated the patient. Like before I think that something is psychological, you would have to have seen me so many times and so much workout would have to be negative. But even still, and this is what I'm learning about the mind-body connection, even if someone is anxious, that still deserves a full investigation to figure out why are they anxious. People don't just wake up anxious for no reason. If someone is anxious, it's because something happened to them in the past, right? So they have some nervous system dysregulation. The body keeps the score. That's a book. You should read it. It's so good about trauma. But the body remembers things. So even if someone is feeling anxious and they are having physical symptoms, abdominal pain, chest pain, shortness of breath, as a doctor, it's still our job to figure out why is this patient's body stuck in the sympathetic response? Why are they stuck in fight or flight? Why are they feeling anxious? Right? So you still need to do your homework. So saying that someone is anxious, thinking that it's a panic attack, doesn't alleviate you from the responsibility of doing your due diligence by that patient. So I just wanted to share that for healthcare providers, especially physicians that are watching. Please practice being better listeners, practice having more empathy, and practice saying that you don't know something and you will look it up. And this is what I said to this doctor yesterday. I said, it's okay to say that you don't know. Most doctors don't know anything about long COVID. I know more about long COVID than most physicians. And, she just kind of looked at me and she was like, she didn't even course correct. And then as someone who's like, I'm a physician, I'm very articulate, I'm well researched, I know my stuff. When I open my mouth to speak, I know what I'm talking about. So I can only imagine how many of you are dismissed when you go to the doctor and you don't feel confident. So that's number one. I know I took a long time talking about number one, but it's do your research. When you do your research, it will make you more confident because you cannot trust and cannot depend on your doctor to know everything about your condition, to know everything about your symptoms, and to know everything about your body. I cannot emphasize that enough. People put too much faith in their doctors. And when you put all your faith in your health in the healthcare system and the doctors, what you really have is sick care. So you as people need to take back control of your health, full control of your health. Second thing, document your signs and symptoms. Okay, so you're feeling dizzy. You need to document when do you feel dizzy, what time of day, what makes it better or worse. Is it better with standing or sitting? Be more observant. Pay attention to when these things happen because that gives important data for your provider so that they can come up with a better differential diagnosis for what could potentially be going on with you. So that's the second thing. Pay attention to what makes your symptoms better, what makes it worse, when did it start? All of these things are really important as far as helping the provider to narrow down your diagnosis. The third thing is to know your medical history. I cannot tell you how many times patients in the hospital know nothing about the medical history. They don't know what medications they're taking. They don't know what surgeries they've had. It's just bizarre to me because it's like it's happening to you. And if you're a passive participant in the healthcare process, You are going to get sick. Mistakes will be made. You might get the wrong prescription written. Medical errors do happen. And so you have to be an active participant. You cannot be passive about your medical history. You cannot even trust what's in the computer. I like to get the information from the patient because it gives me a lot of information about them as far as what knowledge they have about their own health. And a lot of times patients you'll say, oh, look in the computer. It's in the computer. Do you know how many times I've seen mistakes in computers and other people's notes? Not everyone is detail oriented, and humans are capable of making mistakes. So sometimes what's in the chart is actually not 100% accurate. So you have to know your medical history. The fourth thing is write down your questions in advance. You cannot rely on your memory because when you're in the doctor's office, it's rushed. Especially if you go to a regular doctor that's in insurance, the visits are too short. And so you don't have enough time as it is. So you want to make sure that you write down your questions so that you don't forget. That's super important. Make sure you write down your questions because trust me, it's so easy to forget what questions you have in the moment because the doctor has their questions that they're asking you and it's easy for you to forget your questions, but make sure that you write them down in order of importance. You might not get to them all in the visit, but you should at least have your notepad with you or your phone and your notes app and have it written down. Okay, so the next tip before you go to the doctor that you need to do is bring a list of your medications. That list should be on your phone. If you take more than 2 medications, it should be in your phone and a note, or it should be in a piece of paper in your wallet. I've seen some people have a typed up list of all their doctors, the list of medications, the doses, and what they're taking them for, the medical history. It's so helpful. It's so helpful when people come in with a list of their medications on that piece of paper or on their phone. So make sure you have that list with you and bring it with you. And then you should also consider bringing someone with you. If you tend to be forgetful when you go to the doctor's office, if you tend to get nervous and you're not comfortable asking questions and really advocating for yourself in the way that you really need to get the best care, I suggest bringing someone with you who's a bit more assertive, who's a bit more articulate, and who can speak for you if maybe you're shy or maybe you just don't feel comfortable speaking up. It's helpful to have another person also as a second pair of eyes and ears to remember what the doctor said, what the nurse practitioner or PA said. It's very helpful to have someone with you. And I can say that from both sides too. As a physician, I noticed that when someone brought their family member with them, especially if it was like an older family member and they brought like their daughter with them or their son, or if it's like a husband who brought his wife with him, the visit is just more efficient. That second pair of eyes and ears is able to give additional information that sometimes you may forget to give to your healthcare provider. So it's really helpful to have someone else with you. And then the next point is to, of course, arrive 10 to 15 minutes early. Now they tell you this, but this is really helpful because you don't want to be rushing. And they tend to take your vitals quickly in some offices. And if you've, raced to get there, you've rushed inside, your heart rate's going to be up, your blood pressure is going to be up. And if they take your vitals right away, it's still going to be elevated. The doctor's office will tell you to come early to fill out paperwork. And that's important too. But I'm saying that you really need to come early so that you can have time to relax, sit down, get your heart rate and your blood pressure down before they check your vitals. Because some doctor's offices take your vitals almost as soon as you get into the appointment. And then the next thing, and to do not be afraid to ask for what you want and need. So let's say you're having a conversation with a doctor and you think that there may be a particular blood test, for example, that may be helpful because you read online. Don't be afraid to ask your doctor, what do you think about this blood test? Do you think this is a test that I need? If the doctor says no and gives you their reasoning, if you're not satisfied, don't be afraid to ask a follow-up question and give a little bit of pushback, because at the end of the day, you are paying a lot of money to your insurance company. You're also paying a copay to see your doctor. And so doctors, healthcare providers, the healthcare system should be more patient focused, customer focused. You are the priority. And sometimes it doesn't feel like that. Sometimes it feels like it's a factory. Sometimes it just feels like people just don't even care. That's how I felt in the healthcare system, from the people at the front desk who answer the call when you're trying to make an appointment, who sometimes have an attitude, to the provider themselves who sometimes acts like they could care less. But be persistent, don't give up on them, and don't be afraid to ask for what you want and need. I cannot state this enough. In my journey dealing with this rare condition, I have really learned that I have to advocate for myself because most doctors don't know anything about long COVID. And what's also bothersome is that most of them don't even seem to care to even look up and research about it. You know, my friends are primary care doctors, ER doctors. There are plenty of patients that have long COVID. I just saw an estimate that 57 million people have it. And basically what it is persistent symptoms after you have a COVID infection that lasts more than 12 weeks. And so there's a lot of people that have symptoms and don't even know that it's related to that infection. And because healthcare providers are too busy seeing too many patients, they might not have time to stay up to date with the current research, and most don't. And it's really unfortunate. But I'm sharing this with you so that this can help you, that you must understand that your doctor does not know everything, but they will give the appearance that they know everything. They will give the appearance that they know what's best for you because of the training that we've undergone. Some of it's emotionally abusive. So I think when you are battered, right, it's hard for you to sometimes have empathy for another person, I suppose, if you yourself are in an abusive situation. Medicine is toxic for doctors, in my opinion. It's abusive. And so I try and have empathy. You know, it's been a year since I practiced clinically at this point, and I will never go back to practicing clinically unless God tells me that that's what he wants me to do. And I just have empathy for most physicians. But then I also know that they do need to do better. Traditional medicine does need to acknowledge holistic remedies, you know, nutrition, lifestyle medicine, herbal remedies. And then lastly, I just want to say that if you are not satisfied with the care that you're getting at your doctor's office, you have every right to get a second, third, fourth opinion. Do not let anyone make you feel bad for seeing another doctor if you somehow just weren't satisfied with a visit. It doesn't even matter what the reason was that you're not satisfied. It could be just that something didn't sit right with you, right? You're just like, I don't know, that something didn't sit right. By all means, make sure you get another visit. Find another doctor. And I would also add that I personally find that nurse practitioners and PAs listen to my symptoms more and humble enough to know that they might not know something, whereas I find that physicians are less likely to be humble in that regard. And I think that they tend to be dismissive of my symptoms quicker than non-physicians. And it's been a very interesting journey for me as a physician who's treated like this. I mean, it's not horribly, it's not badly. I can compensate for it because I know how to advocate for myself, and I'm not going to let anyone, you know, give me poor service that I'm paying for. So, you know, it's fine, it's whatever. But my heart just goes off for those of you that are not as confident or it's not as articulate as I might be when I'm speaking to my physician, because I am a physician. But I just want to encourage you and help you. And hopefully you can take this video and, you know, have a bit more confidence that it's possible that you may actually know more about your condition than your doctor. Again, they won't tell you this, but if you're someone who's educated and you read, it's possible that you know more about your condition than your doctor. If you have diabetes and you've had it for many years and you've been doing a lot of research about how to treat it, how to heal naturally, your doctor probably doesn't know that information. Oh, and that's also another thing. Don't expect your doctor to know anything about nutrition, because we don't learn anything about nutrition. It's pathetic, to be quite honest, especially now that I know so much that I know about how nutrition can literally prevent disease and reverse disease. We should be learning more about nutrition in medical school and less about pharmacology. A lot of our training is pharmacology, learning about the drugs, the mechanisms, the side effects, learning about the pathophysiology of diseases, but we don't learn anything about how to actually prevent diseases and how to actually help people to heal. So the whole medical system, traditional medicine, needs to be just turned upside down on its head, in my opinion. And it has so many blind spots. I don't think that healthcare providers even realize how ineffective traditional medicine is at actually healing people. And I want people to be healed. I really want you to be healed and medication free, symptom free. That's my goal for you. That's my goal for myself. Like, I never want to be taking medications, and I never want to have symptoms, and I will never stop until, you know, even if I do have a symptom that pops up, I will never rest and stop until that symptom has gone away. And so I don't even take no for an answer from providers. They're like, oh, well, there's nothing that can be done about it. Oh, if they say it's age or it's this, that, and the other, I'm like, Just because they haven't found the answer doesn't mean that there's not an answer. And before I learned about plant-based nutrition, all of my colleagues, my attendings when I was in residency, used to say, oh, kidney disease, diabetes, hypertension is nothing that can be done to prevent it. It's not curable. It just happens from genetics. It's age. And I never believed that answer, even though I didn't know what the answer was at that time. That was when I was at ECU doing my residency, and I finished in 2013. I was not satisfied with that answer. I was like, no, there has to be something that can be done to help people actually heal from chronic kidney disease and hypertension and type 2 diabetes. And about a year or two later, I discovered plant-based nutrition, and I haven't looked back since. So hopefully this was helpful, and I truly want the best for you. I want you to be well. I want you to thrive. I want you to be symptom-free, medication-free. I want you to not need to go to the doctor. I want you to be able to chill, work, have time with your family, do whatever it is you love to do, and maybe just go see your doctor, your healthcare provider for your yearly physical. That's really what I want. That's my goal for myself and for those of you that really want to thrive and live an abundant life. So that's my goal with this channel, and everything that I do really is to help you not need to see a healthcare provider like that, to help you not need the healthcare system, because it is a sick care system. It is a sick care system. It is not designed to help you to heal. It's not designed to prevent disease. And I have always been the person that's not been afraid to say things that need to be said, especially when things need to be better. So hopefully this is a wake-up call. If you're a patient, to take ownership of your health. You have every right to do so, and you should not be afraid to speak up for yourself. Hopefully this is a wake-up call for you if you're a healthcare provider, if you're a physician, nurse practitioner, or PA, but particularly my physicians. Reflect on what I'm saying here. If you're a Christian, a believer, or of any faith, pray about it and ask God to show you, could I be a better listener for my patients? Am I dismissive of my patients sometimes? And just try to do better. We're all on a journey. No one's perfect. But the minute when we act like we are perfect and we have arrived, that's the moment when pride is taken over. So like, subscribe, share this video with someone in your family, your mama, your auntie, your uncle, your dad, your mom, your sister, your friend. Share it with them. It can help them. It can save a life, and it can save you some money too. Trust me. And then also I have a email platform. I send out emails once or twice a week with holistic wellness information. My website where you can subscribe and join my email list is theplantbasedmd.com. I'll have the links for that below. And I also offer online courses and programs. I have a 21-day plant-based prayer and fasting challenge. I have a 30-day boot camp that I'm planning to launch. And this week, we're starting the 21-day plant-based prayer and fasting challenge. It's called the 𝗑𝗲𝗄 fast. It starts on Thursday. It's going to be so dope. It's a spiritual journey to help the body of Christ, men and women, to hear God's voice clearer, pray and intercede for themselves, for our families, for our countries, and also to detox our mind, body, and spirit, to fortify our mind, body, and spirit so that we can be stronger emotionally, mentally, and physically. There is no reason for us to be riddled with sickness, riddled with diseases, dying before our time. And God wants us to be well, because we all have a purpose on this earth. And the sicker you are, the less you are able to fulfill that purpose. And so that's the bigger picture of why I do what I do, because I know how important our assignment is in this earth. And I know that when you're sick, when you're tired, when you have a bunch of different symptoms, your focus is not on serving and fulfilling your purpose. Your focus is on survival, and you're getting yourself out of that place. And so I want you to be well. God wants you to be well. So be sure to like, subscribe, and join my email list. And that's all for today's episode. And I will see you guys in the next video. Take care.